Okay, Lisa, let me ask you a question. What disparities are experienced by patients receiving immunotherapy? I know you treat these patients all the time. So what have you seen in terms of disparities in patients receiving immunotherapy?
Thank you, Massey. And yes, the disparities experienced by patients receiving immunotherapy have been an issue. Immunotherapy is a new approach in cancer treatment nowadays, despite the new development. Low accrual for minority patients into clinical trials may affect the status on treatment efficacy and how the outcome for these minorities will be. It would be hard to know, especially it is sometimes difficult for them to receive therapy in their communities. Differences is that the low income patients and the patient live in the rural areas may not have the resources that they need to understand that immunotherapy is a treatment for them for their type of cancer. Also that getting to areas where they do immunotherapy treatment may be difficult to lack of transportation. Also insurance is another issue that we see with the disparity for patients receiving immunotherapy. With my experience with patients without insurance or lack of insurance coverage, it does take longer for them to get access care through like pharmaceutical industry to provide them with the treatment that they need. And also we have to work with our financial assistance program to work with them on blood work prior to treatment, any imaging that need to be done prior to therapy, and also doctor's visit as well. Those costs can be expensive. And so we are working closely with financial assistance, the pharmaceutical industry to kind of help with these patients to get access for immunotherapy. Again, these are a continuous issue that we are working on. Hopefully that we are getting closer to find solutions for these patients who needs these type of cancer therapies and be able to access in a timely manner so that we can prevent mortality rates for these patients.
You brought up all these great points, and I'm sure most of them again we will cover in other videos too in more details. But I have to say that here in Canada, although we do have some of these challenges, but just because the healthcare system is a bit different from practicing in United States, so insurance usually is not a huge issue for our patients, and there are because we have universal health coverage, so there are also advantages or disadvantages to that. But coming to cancer treatment, especially immunotherapy, we know these treatments work. We know patients come with a bunch of documents in their hands, and then they say, I don't know anything about anything else. All I want, just give me immunotherapy. So they have done their own search. They just come to receive that. And we do have this capability to provide them the treatment if they are eligible and a good candidate to receive immunotherapy. But there are very good points, especially you mentioned about transportation, people that are really so far living in urban area, they even just don't know how to get to their treatment. And socioeconomic disparities comes here to, again, playing a very important factor here. How are they going to pay for these traveling, transportation, if they have to stay there overnight and come back for treatment next day. So there are issues that, as you mentioned, they are still under progress to make sure that people will get the best treatment at the best possible way that we can provide it to them. You brought up very good points, and thank you very much, Lisa.
Thank you.